Let's now go on and we'll look at cardiac massage. If the heart is not working, that is when you'll be able to perform a cardiac massage. And for you to know that the heart is not working, you are going to see the face being blue or pale. That is known as cyanosis. That is because you have got more of carbon dioxide in the body, so the bluish face. The pupils are also going to be dilated. You can't also feel a heartbeat, and the carotid pulse cannot be felt. So if you want to feel the carotid pulse in the neck, you'll not be able to feel it. So now how do you get to treat someone whose heart is not working? You are going to give a smart hit with the edge of your hand on the lower and left angle of the sternum to stimulate the heart. Lower left angle of the sternum. In case the heart does not work, persist striking for 10 to 15 seconds at the rate of one strike or one stroke a second, and then be able to feel for the pulse. And if it starts and it becomes regular, you can then stop. But if it does not become regular, continue striking like that until the pulse can become regular. You are doing this as well as performing an artificial respiration, which can be a mouth to mouth or a mouth to nose. Do not begin thumping the heart or compressing until you are sure that the heart has stopped working. So you don't want to start the performing the cardiac massage if the heart is not, if you're not sure whether the heart is working or not working. Okay. So you can perform an external heart compression, and for the external heart compression, they should go hand in hand with artificial respiration. So this is external because sometimes imagine there's a surgery, you are able to see the heart, you can actually massage the heart directly like that. But this one, you've not performed any surgery. So as you are performing the external heart compression, you are also doing it with artificial respiration. So you compress the heart, the chest, and then you are also performing mouth to mouth. Okay, so therefore, ask the first aider giving mouth to mouth breathing to sit to the right of the casualty and place yourself on the left side. So if you are the two of you performing the heart compression and the artificial respiration, the one performing the heart compression is seated on the left side of the casualty, and the one performing the artificial respiration is on the right. Actually, the heart compression left, artificial respiration right. But if you are just alone, then you are going to be doing it all together. You are going to feel and mark the lower part of the sternum. That is basically where the xiphoid process is. And then place the heel of your hand on the body, making sure that the palm and the fingers are not in contact with the chest. It is the heel of your hand, that end of your hand. If we are talking about hand, we mean that part that you use when you are eating. So the proximal part of that part that you use when you are eating, that's the heel of your hand, near that point where there is the wrist, okay, where there is that joint. So you make sure that the heel of your hand is on the body. But your palms and fingers should not be in contact with the chest, meaning they should be on top. And then place the heel of the other hand over it. With your right arm, press the sternum backward towards the spine. Okay, you are pushing down like that. Adults should be given 60 pressures a minute. So you are pushing 60 times a minute. For children from 2 to 10 years, 3 pressures with one hand or one heel will be enough. But pressure should be 80 to 90 times a minute. For babies up to 2 years, 2 pressures with 2 fingers are going to be enough, applied 100 times per minute. You are going to press firmly but carefully. Carelessness may actually cause injury to the ribs when you do it very much. Okay, and deeper tissues can also be injured. If the treatment is effective, if you know that what you are doing is working, you are going to see the color will become normal from being the face from being bluish or pale. The pupils also constrict, and when they do constrict, you are going to be able to see them improve. The carotid pulse is also going to be seen with each pressure, so you know that what you are doing is actually right. When the pulse is not restored, you are going to continue compressions till the patient reaches hospital. Inflations of the lungs to heart pressure should be 2 to 30, meaning that if you inflate the lungs, how do you inflate the lungs? Inflating the lungs, you're performing a mouth to mouth. So if you push your hair in with your mouth through the mouth of the casualty 2 times, then you need to perform 30 heart compressions. 230 like that. If there is only one first aider, he has to be very smart and active, because you'll be doing the compressions of the chest yourself and also performing the mouth to mouth yourself. Okay. So finish 30 heart compressions, rush to the head side, give 2 inflations to the lungs, and get back to the heart and give 30 compressions, just like that if you are alone. But if you are two, much easier. You are going to repeat these. If there are two first aiders, number one, make 5 heart compressions, and then number two, give 1 lung inflation. So 5 heart compressions for the first one, the second person gives a lung compression. These are going to be repeated at the same rate, at the same time. Number one can watch the pupils, and number two can feel the carotid pulse. Remember, number one was actually compressing the chest. So to make sure that okay, the compressions of the chest are actually working, you are watching the pupils to be able to constrict. Number two was giving lung compressions. So you are also watching to be able to make sure that you feel the carotid pulse like that. So signs of recovery, are going to see cyanosis fading, the bluish color is fading, the pupil is getting strong, the pulse I mean is getting stronger. So being catch is heard during inspiration, groans and a series of gasps. So you hear someone gasping like that, or irregular breathing, you know that okay, something is happening. So this is how you'll be checking for breathing. You can use the carotid pulse, you can see in the neck there. Okay. And we are also feeling if the person is breathing by feeling for the on the nostrils. If the person is breathing, you'll be able to feel some air coming out there. So this is how you get to perform a mouth to mouth. You make sure that at least the neck is extended so that the tongue can be pushed forward, so that when you perform your mouth to mouth, the air is going to go direct instead of being blocked to go to the chest. So this is known as CPR, cardiopulmonary resuscitation. You are performing a cardiac massage and also performing mouth to mouth at the same time. That is CPR. And this is what we call the recovery position, also known as the semi-prone position. It is a nice position when you're performing, when someone needs first aid, because it will enable them to recover fast, enable them to breathe and such. So here we end with a playlist of emergencies in first aid. Thank you so much for having been present from part 1 until now.